From the studios of the Department of Communication in Phillipsburg, welcome to Prime Minister Talks with Honorable Prime Minister Silveria Jacobs.
Hello, I am Silveria Jacobs and this is Prime Minister Talks. Today with a special guest, the one and only Honorable Minister of VSA, Mr. Omar Ottley, who is with us today to share the special event that is happening on Saturday at CPS, the vaccination pop-up, as well as pertinent information about the ministry. Minister Ottley, welcome to Prime Minister Talks.
Thank you. Thank you for having me. Good day, St. Martin, and the viewing public, wherever you are.
Yes, so this is your first time in a live setting of Prime Minister Talks, and today we're doing a special right here at CPS, one of the departments that falls within your purview.
Correct.
And when you came in, it was jumping on the deep end of the pool, dealing with the COVID-19 crisis and the health pandemic. And of course, you have the other responsibilities in social development and labor as well. So, tell us basically what is your main focus right now and how you see us moving forward with this pandemic.
Well, thank you, PM. As you know, COVID is at the forefront. It's related to everything right now. It's tied into social, it's tied into labor. I have to deal with whether it's labor complaints, I have to deal with the employers, the employees. So we try to balance everything. The hardest part is balancing the public health and the labor aspect. Because if we increase the public health, that would be lockdown, scale backs, everything, we would have an adverse economic effect with the businesses and more layoffs and etc. So we're trying to find a balance. And I think the balance is what we are doing today, the vaccination drive. It's not the only way. We encourage persons to have a healthy lifestyle to boost their immune system, but the numbers are there. We have had, unfortunately, I made an announcement on Wednesday that there were 12 deaths for the month of August. 9 were unvaccinated, 2 were partially vaccinated, and 1 was fully vaccinated. The one person had severe underlying symptoms, hence the reason for them passing. Since then, it's Saturday, we have had 2 deaths.
Wow.
So Thursday, we had a death, Friday, we had a death. And it's been confirmed that those 2 persons were also unvaccinated. So now we have a total of 14 deaths, 11 persons unvaccinated. So I just urge the public to do their part. Let us get back to normalcy.
Right. I've been seeing and feeling also the negative backlash. There are a lot of anti-vaxxers out there. We've had Dr. Deutz on the program, and I will encourage the people of St. Martin to go back to those episodes and listen to the facts. Government does not benefit from giving anyone any vaccinations. And so maybe we can go a bit into the vaccination numbers. How far are we now in terms of getting people vaccinated? Because I think people are a little confused with the changes in the numbers once we added the new set of persons that could be vaccinated.
Correct. Well, we started with the drive to 85, and we were about 55% of the adult population. We were required to use the adult population being 18 and up. Once we started to administer the vaccine to those 12 and up, we could no longer use the adult population. So we had to use the entire population, which is 62,323, according to our numbers in the census office. So with that, we are at 41% of persons with the entire population that received their first shot and 36% who received both shots.
Okay, but that's not bad in terms of looking at it around the world with a lot of people hesitant. And what are we doing to encourage people to get vaxxed?
Well, as you know, I have always kept it a free mandate. We're not mandating it, but we have always tried to show the cons and the pros of being vaxxed and not being vaxxed. And I must say that the reports of side effects for the Pfizer vaccine in St. Martin is very low. We haven't had any hospitalizations due to the vaccination. So I like to encourage those persons to consult your GP, have those conversations, and when they give you the okay, I think you should take the vaccination. What I do see happening, though, Prime Minister, we are a small country, and I think the rest of the world will do the job for us, because we see right now U.S. is starting to mandate it in some states. We see France has mandated it, and right now to move around in Europe, you need to show your QR code. So I think that eventually it will be the way of the world, and we just need to seize the moment and take advantage of the opportunity of the free vaccine, which is FDA approved. I must say, St. Martin has gave you the best, the Rolls Royce of vaccinations.
That is exactly, I think people fail to understand. We have to look at the bigger picture. Government has not taken that step to mandate, but we have encouraged, we have enlightened, so provided the information. And so when you look at it, it's either you would vax, or we would end up having to do other things, like making it mandatory that you test before going into certain areas to be able to protect those, especially within the schools and risky areas. So where are we with that in terms of pushing to protect our people?
Well, actually, we are in the process of implementing a policy. Of course, we do everything in consultation with our stakeholders. So we sent our draft policy, as you may know, to the tripartite committee, who in turn gave their feedback yesterday.
Oh, wow.
Yeah. So it's actually positive feedback. We gave people the right to choose between vaccination and non-vaccination. And with the testing, also give the employer the right to protect their establishment. So now what we will do is take this, the feedback from the tripartite committee, and add it to our policy and adjust. And the plan is to have it to come on Tuesday, so that we can approve and implement this immediately.
Wow, I'm very impressed, because I know we've been looking at it now for a year on what can you do to help protect a vast amount of people. And we know that legislation always is a how you call it, a setback. You have to ensure that you're covered legally. And I'm super proud of the Ministry of VSI and all the stakeholders who've gotten it this far. So we're coming up on a break now, and we'll be right back. This is Prime Minister Talks.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacob.
Gen yon maladi nan le monde entier ki rele coronavirus ou bien COVID-19. Li bay problem respiratoire. Sa pou n'kembe nan tèt nou se ki jan pou n'proteje tèt ou ak fami ou. Kontrole santé ou pendant 14 jours si nou te voyaje kite peyi ya. Sou vin développer la fièvre, wap tousse ou bien gen difficulté respirer, rete la kayou pas sorti. Rele docteur sou gen numéro téléphone docteur. Pratike façon hygiénique pour tousser ak pou lave main. Évitez entrer en contact avec moun kap tousse ou bien kap esterne. Sou gen nécessité assistance médicale, rele avant. Expliquez docteur ou bien département urgence lan ki jan senti ou. Expliquez yo si ou te voyager. Expliquez yo si ou pense ou te entrer en contact ak yon moun ki peut-être te exposé à virus lan. Pour plus information, rele 914. Annonce publique sa sorti dans santé, contrôle ak prévention maladie et gouvernement Saint-Martin.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Welcome back to Prime Minister Talks. Today with Minister Ottley of the Ministry of Public Health, Social Development and Labor. We are recording today at CPS, where we're having a vaccination pop-up, so the public is able to come today to get vaccinations outside of the regular week. And Minister, tell me a little bit, because CPS is, I think, the unsung heroes in this whole thing.
Yes.
And a little bit about some of the work they're doing, and that people can understand sometimes when they're saying I can't get through, or whatever the case is, what are some of the challenges and why that may be?
Correct. First of all, I'd like to tip my hat to the staff of the CPS. They're doing the testing. They're administering vaccines. They're responsible for contact tracing. They're the ones you call if you have any queries, whether it's vaccination, testing, however. So they are the COVID task force. They are the driving force behind us being able to open, being able to have some type of normalcy. And I must say, St. Martin is one of the freest countries.
Yes.
We have been commended from Curacao, Aruba, the Netherlands on
Everyone.
the way that we are still able to not lock down
Completely, right.
completely and still have some type of normalcy and have a containment on the virus. What we are at 314 cases. Unfortunately, we have had deaths, but compared to around the world and our neighbors, we are doing pretty good. So I have to tip my hat to the staff of CPS. They are doing a great job.
Yes, having worked with them myself, they're a dedicated set of women. And then the volunteers, well, mostly women, sorry, there are some men as well, but also the volunteers, the retired nurses, and other civil servants who have come forward to assist with some of that back office work. I must commend each and every one of you and continue to show them love because these people work hard. And the people of St. Martin, I want to commend you for reaching out to CPS. They are the source of the information, but we have to understand that we're dealing also with human beings. And at the end of the day, human beings need to rest as well. But we are containing. You've gotten some extra help as well so that they can do some of the background work and keep up with the load, because as the cases become more, it also can threaten your vaccination program.
Correct.
So thank you for keeping them going, as you would say.
And one thing that I would like to touch on, Prime Minister, CPS have reported a lot of non-compliance with quarantine. Sometimes they will call persons and they would be out of quarantine within 5 days or whatever. And this is causing an increase in the spread of COVID-19. It's very important. So the inspectorate and we had a meeting and we're in the process now of creating where we will put in a process verbal to the prosecutor if persons break quarantine, where they can be penalized, because this is basically, you can cause death to someone.
So I want to segue now into understanding. People hear things, and I mentioned earlier about they saying government making money off of this. Actually, it's costing government a lot of money despite the grants we've gotten from the Netherlands. So we say the vaccination is free, but it's not free for the government of St. Martin.
No.
So maybe you can go into a little bit of what are the cost drivers in this pandemic for government.
Well, exactly. One, let's go to the isolation facility that we just had to acquire to assist the hospital. Two, white and yellow cross, the district nurses that we would use for assistance is also a cost that is added on the government of St. Martin. The testing, the everyday testing, which is, I must say, is no longer in Point Blanche. It's at the help desk at Hope Estate. So I use this opportunity. So persons, you go to the help desk in Hope Estate. Also, that's not free for the government of St. Martin. It's free to you, the public. So the government is really doing all that they can for the public to ensure safety. So we just ask you to do your part.
Yes.
That's it. Just do your part.
Right. And to be able to have these pop-ups, it's overtime for the nurses. It's overtime for the persons that have to come and set up and do the testing and the vaccinations every Saturday, that we are busy with that. It's overtime. And the back office work that is being done.
Correct.
It's also extra burden in the finances of the coffers of St. Martin. So it costs us a good bit. We are getting the vaccines at this point, but at some point that will stop and government will have to pay for the vaccines, and others who want to use it would no longer be able to get it for free as well.
Correct.
So this is an opportunity to still make use of it, and I would encourage you to do that. And so while we're talking about costs, I know a lot of people have complained about the cost of pharmaceuticals and looking at getting the testing also, the self-testing in the pharmacies. Maybe you can tell us about what VSI is doing where the pharmaceutical cost is concerned.
Well, definitely. Of course, we know that the cost of medicine is extremely high, and by extension, it puts a burden on SZV. And people don't realize that the money that SZV has is not SZV's money. It's your money. It's the people's money. It's your pension. So now, as Minister of VSI, my job, and we all know it's no secret, SZV is bleeding severely. So my job is to see where we can stop this bleeding. And the PCCP, Pharmaceutical Cost Containment Program, is an amazing program. It basically puts a cap on the amount of profit that can be made. LOI was signed between the pharmacies, so we always involve the stakeholders in which they agree, and then this is set to save us between 12 and 17 million a year.
Wow.
So that'll be something that is amazing. So I think that we're headed in the right direction when it comes to that.
I think that's an amazing thing because until people leave St. Martin, they don't realize how good we have it where health insurance is concerned with SZV. In the private sector, in other places, there is a copay that you have to pay at the spot, on the spot. So whether it's hospitalization, whether it's medicine, therapy, whatever. And at this point, most people pay it within their salaries, it's deducted or whatever the case may be. And so I must say, within healthcare, we are in the Caribbean for sure, ranking quite high. And I'm grateful for what we have with SZV. So anything you can do to save SZV some money, which is our money, is going to be good for us in the long run. We'll be right back. So we're on to another break. Stay with us. This is Prime Minister Talks.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Coronavirus is most likely to spread from person to person when we come into close contact with one another. We can all help stop the spread by keeping our distance. This means do not shake hands or exchange physical greetings, and wherever possible, stay at least 1.5 to 2 meters away from others. It's also really important to practice good hygiene, especially after being in public places. Together we can help stop the spread and stay healthy. Visit stmartingov.org/coronavirus or call 914 to learn more. This public service announcement is brought to you by the government of St. Martin.
Good day, I am Minister Ottley, and we are here at the vaccination pop-up at the Vineyard Building. I would like to introduce to you the faces, the real heroes behind the scene. I am the one in the forefront, but it cannot be done without the CPS staff. So we are here, we are going to give you a little walkthrough and explain to you the procedures you need to do to get vaccinated.
Good day, I am Nurse Flawn. I'm one of the team leaders from the vaccination program.
Good day, I'm Nurse Richardson. I also am a part of the vaccination program.
Good afternoon, I'm Nikisha Carty. I am the coordinator of the COVID vaccination.
Good afternoon, I'm Dr. Daphne Ellis, and I am usually in the observation room, and I'm over the youth health care. Once you come in, you let the security guard know that you are here for vaccination. There's ample parking available, so she will let you in to come in to the parking area. Then there is someone that will guide you to the registration table where you will be registered, so you'll be put into the system. ID would be taken. We would need a picture ID, that is to verify that you are who you say you are. It doesn't have to be a valid ID, but just a picture ID of you. After registration, if there's a long line, we have you sit under a tent with social distancing, and everyone is wearing their mask. So that, and there is hand sanitizer once you enter the building. So you go in after registration, your ID is taken to the desk where you have to sign a consent form. So the nurses are there with you going through the consent form. Once that is signed, you go to the area for vaccination. There are the nurses that gave you the vaccine. Once vaccinated, you're taken to the observation room, and there you would be observed for 15 minutes. If you have allergic reactions to any medication in the past, some persons would wait longer than the 15 minutes, so they would get an extra 15 minutes in the observation room. There's a doctor and an EMT personnel or a nurse, but someone that knows first aid, CPR, and we have the observation area where you're observed for 15 minutes. After 15 minutes, if everything is okay, you are allowed to leave, and you would get an email sent to you explaining to you that if you have any side effects, you can register your side effects on the site so that we can register them and send it on to the Netherlands of any side effects that are seen in our vaccinated population.
Prime Minister Talks with Honorable Prime Minister Sylvia Jacobs.
Welcome back to Prime Minister Talks. We're into the last segment now for today, but of course you can always come back. We will continue to update you on all matters that are pertaining to government, and especially now where we're dealing with what we're dealing with. We were just talking about SZV, Minister, and ways and means that the ministry is looking to save money so that we can be using the money more efficiently, effectively, and safeguarding it for the future of the people of St. Martin. There are certain laws that required some upgrades. Can you tell us a little bit about that?
Yes, correct. One of the top priorities right now, it's raising the salary cap, the coverage amount for SZV. We're raising it to 120,000 per year. This will allow more persons to be covered under SZV. This would also give SZV the chance to increase its revenue. One of the others that we're working on to formalize the 62 plus. At this moment, there are senior citizens that are overqualified for government insurance.
Oh, okay.
So then what we do, they will be sent to SZV and they would be insured. We do it on a humanitarian basis at this point, but we want to
make it more structural.
Correct. Some of the other things that we're working on in SZV is also allowing the transfer of funds for different, which is happening now, to pay different bills, etc.
Correct.
But we want to make it, put it in the legislation to make it more structured. So a lot of things that we're doing, we realize, okay, let's formalize it, make it correct, and I think that it would benefit SZV in the long run. I really do.
Okay, I think we would probably be able to have a more in-depth discussion at some point as the legislation comes up. It's currently being worked on within the ministry?
Yes,
or?
we actually have, I have a presentation Tuesday.
Oh, okay.
So it'll be presented on Tuesday. We'll go through with the whole team. It's also a work team. But what I want to say, Prime Minister, is that we know what we have to do. There's also, as you know, with the country packages, there's also some
requirements, yes.
Yeah, some requirements of us. And I think that if we have stuff ready, I like to put it forward. I don't think that the Netherlands needs to tell me or any of us
what you know you need to do.
We need to do. So we have a great team. We have a whole team working on it. SZV is on deck. Persons within the ministry is on deck. When I say on deck, on board.
Right.
And I think that once we push, I think that the people will gain more confidence in us, and the Netherlands will be able to see, okay, these people now are on the right track. They know what they're doing.
Well, I can say actually from my personal experience, they have noted that already. They've seen the commitment of this government to do the right things. They have been in the planning for a while, but finances and human resources has always been our problem. So with the cooperation in certain areas to get assistance with the legislative writing especially, we are moving forward with that and seeing a lot of gains, even though, you know, in certain respects, the country package issue was forced on us. I could tell people I could buy into it because it's talking about things that we knew we should have been doing all along. So in that respect, we will get there faster, and if they give us the necessary assistance, better for us. So in terms of today and what your expectations are from having a vaccination pop up, we haven't had one in a while. What is your goal with this one?
I tell persons, as long as when the numbers come in, I don't see zero, I'm happy. You know, the vaccination rate is going pretty slow, some call it, but we are averaging about 50 new persons a day. But that's 50 persons that didn't have it yesterday.
The day before.
That's 50 more persons that are protected. So it's a numbers game. I think we're going to get there. We're getting there slowly. We're starting to get back in the groove. So let's see how today go. But it definitely will not be our last, and we will continue to do what we need to do. At the end of the day, Prime Minister, I just know that I can rest my head, look myself in the mirror, and know that I have done all that I have done. We have done all that we can do.
Right.
And that's it. You know, somebody will have to get the blame.
Yeah.
But once I know that we have extended the vaccinations, not once, not twice, but 3 times, the mass vaccinations. We have made it available. We have provided, we came to your community.
Right.
We did everything that we can do, and we will continue to
Right.
do. So that's all. Once I can look myself in the mirror at night, I'm at peace.
Good. I think for us as a country, we need to learn to appreciate actually the position we're in. We're able to go back to some level of normalcy.
Yeah.
Businesses are able to be open so that people can work and take care of their families. And everybody now understands that a lockdown doesn't make sense. And I took the flak last year. We didn't know what we were dealing with,
Of course.
but now we know what the vaccines can do. Plus, back then, without the vaccinations, we knew that wearing masks, social distancing, and a high level of hygiene kept it under control. So even though we're dealing with Delta now, we need to just uphold those protocols, hold the persons accountable in the public sphere who don't. And when we set that example, people will see that we're dead serious and that our people's health comes first.
Correct.
So with these last few minutes, I'm going to give you the last few minutes, Minister, to tell the people of St. Martin from the heart, as you do so well, why it's important for them to protect themselves and others during this pandemic.
Thank you, Prime Minister. Let's go on facts, statistics. Right now, I go to the US, 98% of the hospitalizations are unvaccinated persons. I bring it here to us, our latest results of the deaths I just said. Out of 14 deaths in the month of August, 1 person was fully vaccinated and they had serious underlying conditions. We are in a partnership with the Netherlands, Aruba, and Curacao with the vaccines. Politicians in the Netherlands are saying, why are we sending the vaccines to St. Martin and they don't want it? When in the Netherlands, it's not available to everyone. I want St. Martin to realize that. Persons in the Netherlands, not everyone can get the vaccine at this point. And we are blessed in administering it to the entire community. And persons are saying why, and they don't want it. So I just want to let that sink in for a second. Don't wait till it's too late. We can't get you back if you leave us. That's all I can say.
Thank you so much, Minister Ottley. I believe the people of St. Martin have seen your heart. And I think that has touched us. I mean, I was in press briefing with you when I myself was like, don't speak, because that was powerful. There's nothing more to say. And we will be judged. In Dutch, we have a statement, hoge bomen vangen veel wind. And the thing about us Caribbean trees is we have faced hurricanes and our coconut trees don't fall. We bend, sometimes we end up staying bent for a while, but we continue to produce fruit. And so I thank the people sometimes for your feedback, because some of it is good and we could take it and run with it.
Correct.
But I believe the commitment is there, the intention is to save lives, and that is all we're out for. So go out and get vaccinated. I mean, you can make all the memes about me that you like, but I'm going to continue to promote the vaccination because it saves lives. I've had friends and loved ones face the burial of their parents, face the burial of their sisters and brothers, and right now in a state of worry because someone they love is on a ventilator or they're in hospital on oxygen and they're hoping that they won't get any worse. This is a real situation. So protect yourself, protect your children, because now in the US, they are the greatest amount of persons ending up really, really sick. Of course, your start off, health has a lot to do with it. So get healthy, start to exercise, start to eat the right things. We have bad habits in our culture that we need to break. And that's something I'm willing to collaborate with the minister on in promoting a healthy St. Martin. So stay safe, protect yourself. It's all up to us. Until next time, St. Martin, this is Prime Minister Talks.